Throughout the course of the fall of 2022, did you notice any changes in Lindsay's physical health?
I think I saw her one time at drop-off, and she just seemed thinner, more
You
frail.
seemed, I'm sorry.
Thinner.
Okay. Did you ever have a conversation with her at drop-off about your observations?
No.
How about just observing her overall demeanor? Did you notice anything change about her in the fall into the winter of 2022?
No.
Did you ever have any conversations with her about postpartum depression or sleep issues?
No.
And I'm going to draw your attention to January 22nd, 2023. That was a weekend. Do you recall that weekend?
Yes.
And did you have something happening at your house that your family invited the Clancys to?
Yes, we had a bonfire.
And who came from the Clancy family to the bonfire?
Pat, Lindsay, Cora, and Dawson.
Where was Callan, if you know?
At home with Lindsay's parents.
Did you have the occasion to speak with Lindsay on that day?
Yes.
And fair to say, prior to that day, you hadn't really seen her much that winter?
Correct.
Were you happy to see her that day?
Yeah.
And what were your observations of her that day, her demeanor? Did she seem normal or off? Or
Just quiet, but fairly normal.
did you have the occasion to speak with her, just you and her?
Yes.
And was that outside at the bonfire or somewhere else in your house?
In the kitchen.
And did you ask her anything?
I was talking to her about my daughter's allergies, and then the conversation lulled, and I asked her how she was doing.
And what did she tell you?
Good.
And did you have any further conversation or ask any follow-up questions?
No.
Why didn't you follow up?
Because I figured if she wanted to explain or deep dive into it, she would. Wasn't going to press her.
But on this occasion, she just said fine, and you kind of moved on to the next topic?
Yes.
And throughout the course of that day or that afternoon that you were with her, did you notice anything change about how she was communicating with you? Like, did she start to talk faster or seem confused in any way?
No.
Was there anything that happened at that interaction that made them abruptly leave?
No, I think it was like nap time for the kids.
Okay. And was that the last time you saw or talked to Lindsay?
Yes.
Nothing further, thank you.
All right. Mr. Reddington?
Morning. So, what was the time frame that you knew Lindsay, not Patrick? I know you were very friendly with Patrick.
Yep.
What was the time frame that you knew Lindsay?
12 years.
And would you say that you were close to her, or were you social, or how?
Social.
Social.
Yep.
And on occasion, you had the opportunity to be.
And did you go through, a report of history with her?
Yes.
Were you able to make an assessment of her mental status during that interaction with her?
Yes.
And what were your observations of her mental status?
I can remember certain elements, but I don't remember. She was dressed in, she was appropriately dressed. Her speech was of normal rate and volume. Behaviorally, she was polite and cooperative. Her mood, I don't remember exactly. It's a quote, so I don't remember exactly what she quoted her mood as being. It would be in the medical record.
Yeah, one moment. I'm just going to approach, if that's okay.
Yeah. And just so the records are Exhibit 79?
Yes.
All right, so those records, you'll have those with you. Okay.
So I have pulled pages 61 through 66. So I think that's your note. If you can just take a look at that and let me know when. that refresh your memory as to what your observations were of her mood?
Yes,
What was her mood?
anxious.
Okay. And did you observe signs of anxiety, or did she tell you that she felt anxious?
She appeared anxious.
And her affect, did you observe it to be congruent to her mood?
Yes,
And you examined her and found her to have linear thinking and appear goal-directed, right?
yes.
And as far as addressing kind of why she was there and what your recommendations were, ultimately, what were you trying to address or accomplish in the treatment plan with Ms. Clancy?
That's a very broad question.
Okay, I could break it down if that's okay.
Yes.
So as far as once you had a chance to sit and talk with her, what did she identify to you to be her main concerns that she wanted to address during her stay at McLean?
She did not want to be dependent on an antipsychotic medication, which is what Seroquel's class is, even though it's used for insomnia and other indications, depression. She didn't want to be dependent on Seroquel to be able to fall asleep.
Okay, and so fair to say she was very concerned about wanting to sleep at night.
Yes,
And she was very concerned about her symptomology, or what she was experiencing by way of symptoms from various medications, right?
yes,
And that concept, or the phrase numbness, did she use that a few times?
yes,
And again, you mentioned Dr. Madvo was concerned about the numbness with the medication. In your experience with Seroquel, is that also a common side effect for people to feel numb?
it can be one of the side effects that people can have.
Okay. And as far as the suicidal statements that you were aware of from the prior reports, did you go through that with her about whether she presented to you with suicidal ideation?
Can you ask me that again?
Sure. Did you talk to her about her thoughts of suicide?
Yes,
And did you talk to her about whether she had any specific plan?
yes,
Did she have any plan?
no,
Had she reported that she had ever had a plan for suicide?
no.
And did she tell you there were reasons why she thought she wouldn't commit suicide?
Yes,
And what were those reasons?
her children and her family, her mother.
So after this face-to-face interaction with her and kind of going through her history and having reviewed what you had, the information you had about her, what did you develop as a plan for her while she was at McLean?
I continued with the plan to taper her off Seroquel and to monitor whether her symptoms improved, but also to see if she could sleep while she was off of Seroquel. And to really observe symptoms and mood.
During this first interaction with her, was there any conversation about how long she would stay or what her plan might be after she left McLean?
When we met the first time, Lindsay said that she had her daughter's birthday coming up on the weekend, and that it had been planned months ahead of that date, and she was hoping that she could be there that weekend so she could be with the kids and family who was going to come for the birthday party.
Now, the concept of kind of tapering her off the Seroquel and monitoring her symptoms, did that seem like a realistic goal to you?
Yes.
And now, after having spoken to her and developing this plan, were you also cognizant or thinking about the potential for a bipolar disorder?
Yes.
diagnosis. And so how did that affect how you approached this plan to taper?
Again, we were observing for any symptoms that would indicate that she might have bipolar disorder.
And where she had reported that she had issues with sleep, was that also something of concern to you if there was the potential for a bipolar disorder?
Yes.
And reduction of medication, what was the concern for the sleep?
I think people's mental health is negatively affected if they cannot sleep, whether it's bipolar disorder or depression. And so sleep is important.
Okay, and so a person that you might be considering for a bipolar diagnosis would lack of sleep make you watch for symptoms of hypomania?
Yes, sleep deprivation can lead to a bipolar episode, a hypomanic manic episode.
So you wanted to monitor her patterns in her sleep and her mood to see if there was any evidence of that, correct?
Yes.
Leaving on Thursday the 5th, without having monitored her at no Seroquel.
I did not have any concerns about her safety or a risk for anybody else.
Okay, but as far as from a diagnostic perspective, would you have preferred to have more information about her sleep patterns and her mood?
Yes.
Okay. Now, you said that you didn't have a concern for her safety. So what, in your time that you were with her, that you met with her, and all the information that we reviewed, what were identified as maybe protective factors that made you feel comfortable that she was safe?
She was, there's several things. She was future-oriented. She was clearly invested in her children. She was a caring mother, just like a caring mother. She had her parents around to help her. She had family and supports. We ensured that she would have outpatient psychiatric care for follow-up. She didn't have a history of suicide. She had no history of psychosis, postpartum psychosis. She had a stable place to live. So
the statement that she made to you that she wouldn't have completed the act of suicide because of her kids or her mom, was that something that you considered?
Absolutely.
And the fact that during the time from admission on January 1st to the time she was discharged on January 5th, that she didn't make statements supporting suicidal ideation, was that a factor that you considered?
Yes.
And at no time during the time she was at McLean did she ever indicate that she had ever reported or had thoughts of harming anyone else, did she?
She had never stated that she had any thoughts of harming anybody else.
And ultimately, at the end of that conversation with her, or the hour later, she was able to secure that appointment that you asked her to on her own.
Correct.
And so knowing that now the discharge has moved up a day, what was your plan for medication for her upon discharge?
She would have continued on the Ativan to help her sleep at night. That was a short-term plan. Once she was feeling better or was able to sleep or her mood came back to baseline, she could taper off of it. She had trazodone to use as needed, and melatonin.
And as far as your recommendations for medication, it would be no more Seroquel. I guess, let me ask that question a different way.
Yes.
You didn't give her a new prescription for a different dosage of Seroquel, did you?
No.
And did you advise her to take Seroquel when she was home if she felt that she needed it?
I would assume she would take what I had prescribed.
Just to back up 1 second, as part of this treatment team plan for patients at McLean Hospital, is it fair to say that either you or other members of the team, either a mental health worker, social worker, or nurse, sometimes reach out to collaterals in order to try to gather information and assess a patient?
Yes.
And in this instance, are you aware that somebody reached out to Patrick Clancy to speak with him about his wife and her care?
Yes.
And were you aware that he reported that she hadn't ever had suicidal thoughts?
Yes.
And that he actually reported to the social worker that she was concerned about dependency?
Yes.
But she had told you that her husband was concerned. Is that correct?
Yes.
And that he felt that she had succumbed to social pressure to take psychiatric medications because her friends were taking them?
That's what he told the social worker.
And you're aware that he had made statements that he was unhappy with the medical care she was receiving at McLean?
He said, I don't think
Were you aware that he said he was very unhappy with the medical care she received?
she received. Yes. She didn't specify. He didn't specify McLean.
Okay, thank you. And as far as you're aware, the patient themselves, Ms. Clancy, she never complained that she wasn't getting seen by staff or doctors, was she?
She never complained of that.
Did she ever file any sort of complaint with the hospital?
No.
And is there a mechanism for a person to file a complaint if they feel like they're not being treated?
Absolutely.
And is that information posted all over the units?
It is posted on the unit and the forms are available.
And a person, even if they're not on a one-to-one or directly interacting with a mental health worker or social worker, do they always have the ability to request to speak to somebody?
Absolutely.
And so even when maybe somebody from their team is not there or working, is there somebody always on call, a mental health worker, a social worker, a psychiatrist, a nurse, for a person to speak to if they felt they needed to?
Yes.
And in addition to your meeting with her on January 4th, and after coming up with that plan for discharge on the 5th, are you aware that she then continued to engage in groups on the 5th, and that she continued to engage with mental health workers and social workers?
Yes.
And do you recall when she was discharged on the 5th? Was it in the morning or in the evening?
Afternoon, probably around 3-ish is my recall.
Okay. And upon discharge, was she provided with information that she could use when she was home? Like resources?
Yes.
And do you recall that she had asked about resources to find a new doctor at some point?
Yes.
And that she ultimately reported to the social worker that she felt comfortable managing at home?
Yes.
If I may have one moment.
Sure.
So upon discharge, what did you actually prescribe her?
A 14-day supply of Ativan and a 14-day supply of trazodone.
Okay. And when you were having conversations with her about her thoughts of suicide or her thoughts of wanting to die, was she expressly asked if she wanted to kill herself?
Yes.
And what was her answer, if you recall?
She denied that.
She denied that?
Yes.
And was she specifically asked if she had a plan to kill herself?
Yes.
And what was her answer to that?
She denied it.
And was she specifically asked if she wanted to harm anyone else?
Yes.
And did she provide an answer for that?
She denied it.
And those are standard questions you would ask at every interaction with her, correct?
Yes.
And prior to discharge, she would also be asked those questions again, correct?
Yes.
Because if her answers changed at any point, it would have changed your plan, right?
Yes.
Thank you.
It's just that she reported that she went for 48 hours without sleep.
I don't remember that time quoted. I know she had difficulty sleeping.
You indicated in your testimony that, and I quote, I would have preferred to have more information about her sleep patterns, right? Do you remember saying that?
Following the changes in the medications that we were making.
So sleep pattern would be just what it says, sleep pattern, like you sleep from 9 at night till 7 in the morning or
Yes.
12 at night, whatever your pattern would be, right?
Yes.
And why is a sleep pattern important for you as a psychiatrist trying to evaluate your patient?
Because difficulty sleeping is a symptom of several different conditions, and it can worsen several different conditions.
And you know that she had reported severe anxiety, right?
She was struggling with anxiety, yes.
Struggling with anxiety, and she was having not just insomnia, but she had very, very severe insomnia, didn't she?
She wasn't able to sleep.
And you would prefer to have more information about sleep patterns, is what you said. I'm not putting words in your mouth. That's what you said.
I know that we were able to observe her sleep while she was on the unit. Once she left the unit, I would not know how she was sleeping, which is why we referred her to somebody else so that they could continue to monitor her symptoms.
Obviously. So let's put the time that you are observing her or that your social workers are investigating to whatever extent they did, her background. What were her sleep patterns that were important to you prior to New Year's 2023?
The amount of sleep is important.
Yeah, and you said that. You already said, I would have preferred to have more information about her sleep patterns.
After she was if I was going to continue to evaluate her, I would want to observe her sleep is what I meant.
Oh, so you didn't mean that as an evaluator of her prior medical history, trying to get a history of your patient for purposes of diagnosis and treatment, that you wanted to know what her sleep patterns were. You didn't mean that you meant prior?
The history of whether somebody's struggling with insomnia is important, and the patient can relay that to me.
Okay. You ever heard of patients that minimize their symptoms and lie about their symptoms sometimes?
Yes.
Okay. So it's important to corroborate what the person is telling you, right? I mean, you want to talk to somebody else objective to find out what, if any, evidence there is of symptomology.
And we did that with Patrick.
I'm sorry?
So when a patient presents and they're talking to us, it is not just about what they are saying. It's about their body language, their eye contact. You can get a sense of whether a person is being honest or whether they're lying. And we are not, we're providers. The patient is there to get help. They're going to tell us what is bothering them and what they're concerned about. That's why they're in the hospital.
This woman was in a locked ward. She couldn't walk off your unit, could she?
That is what a psychiatric unit is.
Right. And she was very sick, wasn't she?
I don't know what you mean by very sick.
Really? You indicated that you would assume that she would take what I prescribed. Do you do that with all of your patients? Assume that when they have mental disease or a defect that they would do what they're told?
If they are cooperative, and they have been cooperative and reliable, yes.
One of the things that's referenced would be she stated that she had intrusive thoughts. Remember that?
Yes.
What were the intrusive thoughts?
From what's stated in the medical record, thoughts of suicide.
Okay. And how often would she have the intrusive thoughts?
I don't recall if the frequency.
Would you agree with me that in addition to anxiety and in addition to inability to sleep, that she was in what was self-described as a brain fog, right?
She complained of feeling, yeah, you can complain of feeling foggy.
She also complained about that she felt as if she was a zombie, right?
She did not use those words.
Anybody else use that word describing her in your investigation?
No.
Did Patrick tell you that he was concerned about the medications that she had been prescribed over the past 2 or 3 months?
Yes.
And you knew what the medications were that she was prescribed, correct?
She told us.
She told you, okay. And she told you that she was prescribed, in addition to the SSRI Zoloft that was increased from 25 to 100, that she was then told...
I was aware that...
I'm sorry, 50.
Correct.
She was then told to stop taking the Zoloft by Dr. Tufts, right?
She reported not being able to sleep, and they agreed that she would not take the Zoloft.
Okay, so the answer is yes. She was told to stop taking the Zoloft by Dr. Tufts, right?
I think you would have to ask Dr. Tufts that
Oh,
question.
I will. But I'm asking you, as investigating her...
I know that she stopped taking the Zoloft, and that she saw Dr. Tufts, so I assume that they would have come to that agreement.
All right, so as you're evaluating this patient, you're assuming that she voluntarily stopped taking the Zoloft?
Because she wasn't able to sleep, and she discussed it with Dr. Tufts.
She did. You knew that.
She told us she did.
Okay. How many patients have you treated, how many women have you treated that were suffering from postpartum psychosis?
I don't recall. I don't remember, but I think it would stick in my memory, so I don't think that I probably have.
You don't think you probably have?
I don't think I have. I haven't seen any.
How about postpartum depression?
Yes.
And how many patients have you treated with postpartum depression?
Over the last 20 years, I wouldn't, there are lots of patients I have seen. Okay. I don't keep a record of what diagnoses and what people I see.
Or any reason for you to seek a Section 12?
No.
Your next appointment with her was January 23rd, 2023, is that correct?
Yes.
And again, all of these appointments were virtual appointments, correct?
Yes.
During this appointment, what was her mood and affect?
Mood was depressed, affect was depressed and flat.
Did she tell you she had started the amitriptyline?
She did.
And did she tell you if there were any side effects to that?
It didn't appear that there were side effects.
What was the conversation or interaction with her that day on the 23rd?
So she said she was doing all right, a little more anxious, and the anxiety was described as the feeling of her heart racing. She had a decreased appetite as well. She was on only 2 milligrams of Valium at this point and feeling more anxious in the morning. Mood was the same, flat, anxious, no motivation, numb. She has to force herself to get out of bed and out of the house, but is able to do that. And she is sleeping okay.
And did you ask her if she had suicidal ideation or homicidal ideation on the 23rd?
Yes, I did.
What was her response?
No.
And did you notice any symptoms or signs of psychosis that day?
No.
Was her was there any difference in her rate of speech or speech pattern?
No.
Was there any difference in her ability to think or communicate in any way?
No.
Was there any change in her your evaluation of her judgment or insight?
No.
Did you still consider her insight poor at that point?
I did.
And why were you still considering her insight poor?
So I think there were just a couple of things that came up throughout our 14 visits that suggested that to me, like I explained earlier. But later on, it was it had to do with her over attribution. It seemed to the medications about certain symptoms that she was feeling, meaning like how she felt about the Seroquel, how she felt that was making her depressed, when in reality, I think she was just depressed. So it was related to her thoughts about medications and how she was feeling.
So would it be accurate to state that instead of accepting that she was depressed, she was placing the blame on the medication?
Sustained.
In your mental status exam of her on the 23rd, how was her appearance?
She was appropriately dressed.
How was your rapport with her?
It was appropriate.
How was her speech?
It was appropriate.
How was her thought content and process?
Appropriate.
How was her cognitive abilities?
There were no deficits.
And her psychomotor activity?
Normal.
What was the plan going forward on that day?
So we were going to continue the same dose of the diazepam because she was feeling a bit more of the anxiety. So we said to slow down the taper, and we increased the amitriptyline to 20 milligrams, thinking that would also help with the sleep.
And at any point in time, did she tell you she was planning to kill herself?
No.
At any point in time on the 23rd, did she say she was planning to kill her children?
No, absolutely not.
At any point in time during your interaction with her in that session, was there anything about her affect or demeanor, her behavior, that indicated to you that she was a danger to herself or others?
No.
Was there any reason, based on your evaluation of her in that session, that would give you grounds to file a Section 12 on her that day?
No.
Throughout your time treating Ms. Clancy, did you continue to recommend that she attend individual therapy?
Yes.
And why is that?
It's very important.
And is there a reason it's important, or like what are the benefits?
Yeah, it has many studies have been done to show the efficacy of therapy as a component of treatment for depression and anxiety. So, some people may only do medicine, some people may only do therapy, but the best response is a combination.
Thank you, Dr.